Okay, so we have our scene survey. So our scene survey is the first step. Okay, you always want to make sure that you are the #1 priority, and you want to make sure that the scene is safe. So you're going to look around. Are there any hazards, right? And we talked about that picture yesterday, right? So this picture here, you see the car that's on fire. You see people injured. So this scene is not safe. Okay, so in that case, you get out of there. So if the scene is safe, you enter. The scene is not safe, you get out of there. All right, and then we're going to call 911 and tell them, hey, there's an accident here. Hey, this person has chest pain. This person needs help, and tell them where to come. All right, then the next step, we're going to do our primary survey. That's what we covered yesterday, the airway, breathing, circulation, and deadly bleeding. Okay, and then we're going to do our rapid body check only if we see blood. So you walk in, you survey the scene, make sure it's safe. You see blood leaking from the person's body. We put our gloves on and we do a rapid body check, looking and feeling to see where is the blood coming from, and we stop it. We hold onto the blood, onto the bleed, so that the blood doesn't leak out of the body. Okay? So when you think about the importance of blood, why do we want the blood in the body? Well, it's supposed to be there, but the real reason is that blood carries oxygen. All right, so everyone take a deep breath in. Yeah, so what you just breathed in was 21% oxygen. So there's other gases, there's carbon dioxide, right? There's nitrogen, there's other gases in the air. So when you take that breath in, everyone take it. Right now, air is free. I guarantee one day they're going to start charging for oxygen. They're going to start charging for air. I guarantee the government's going to find a way. But right now, air is free. So everyone take a good breath of free air. So what you just breathed in was 21% oxygen. Okay? And so there's other gas included in that. So it's not 100% oxygen. It's only 21% oxygen. So when you breathe that in, right, that goes into the lungs, crosses over the barrier and attaches onto the blood. The blood will carry that off to your organs, up to your brain, to your heart, right, to every single cell and tissue that needs oxygen in the body, right? But if the blood is not there, then basically the blood are like train cars, like a train carrying oxygen and dropping it off, and then coming back and picking up more and dropping it off. So if you don't have blood, you don't have the train cars that are needed to transport the oxygen in the body. Does that make sense? All right, that's good. So let's go to the next step. So we had our scene survey, making sure it's safe. Our primary survey, A, B, C, and D. Okay. Then we did a rapid body check to see if there's any blood. Okay. Now we're going to go through the secondary survey. All right. So let's do that. So with secondary survey includes the history, vitals, and head to toe. So you can remember primary because it's the alphabet, A, B, C, D. And now you can remember secondary because I made up a little song. And it goes like this. History, vitals, head to toe, head to toe, head to toe. History, vitals, head to toe. That's secondary survey. All right, everyone sing it with me. Here we go. History, vitals, head to toe. History, vitals, head to toe. Head to toe, head to toe, history, vitals, head to toe. That's secondary one more time. History, vitals, head to toe, head to toe, head to toe. History, vitals, head to toe. That's secondary survey. All right, there you go. So that's how you can remember the secondary survey. Okay, so history, we're going to ask them questions. Vital signs, we're going to measure vital signs on the body that are important, so vital. The important signs in the body. And we're going to do a head-to-toe assessment, head-to-toe check to see, is there a broken arm, is there a broken rib, right? We're going to find all of these things, all these new injuries. Okay? So let's look at the history part of it. All right, so you see someone sitting there, they're holding their chest, they have chest pain. So you walk in, you survey the scene. Is the scene safe? We enter. You say, hey, are you okay? What's going on? The person says, oh, I have chest pain. Oh, do you want me to call 911? Call an ambulance for you? And they say yes. So, hey, go call 911 and grab a defibrillator that's down the hall. Okay, and at West, the defibrillator is on that second floor. As soon as you walk up the stairs or you come up the elevator, it's right there. So if you come up the elevator, turn right. If you walk up the stairs, as soon as you enter that top door, you'll see the defibrillator right on the wall. Okay, so normally we would actually take a field trip to the defibrillator and open up the case and show you how it works and everything. But yesterday we learned how to use the defibrillator. So if you get into the building, you'll be able to see the defibrillator. You'll actually walk by it every day. So if anyone has a problem, you can grab the defibrillator and use it on someone who's dead. Okay. So for this person who has chest pain, we want to think A, B, C, and D. So there's no deadly bleeding. You don't see any blood leaking out of their body. They're talking to you. Their airway's open. They are breathing, and their heart's beating. Right? So primary is done. Now we can move into the secondary survey. So the secondary consists of taking a history, measuring vital signs, and doing a head-to-toe assessment. All right, so let's ask them questions. So basically, you walked in, you called 911, and now we jump to the secondary survey to ask them questions. So we want to ask them these questions here. So we want to say, want to ask them about their signs and their symptoms, and then we want to ask, do you have any allergies? Do you take any medications? What previous medical history do you have? Okay. When did you eat or drink last? And then what happened right before the incident? Right before this chest pain, what were you doing? Okay. So those are the questions. So I want you to commit this to memory. So for sample, we call it taking a sample history. Okay. So I'll just demonstrate a conversation using this acronym. Okay. So the person has chest pain. They say, "Oh, I have chest pain. Do you want me to call an ambulance?" They say yes. Okay. So hey, call 911 and grab a defibrillator. Okay. And then so I think A, B, C, and D. There's no problems there. So I move into my secondary survey. So a secondary survey, I can say. So I'm thinking history. I'm thinking sample. So signs and symptoms. So, ma'am, do you have any chest pain? Or let me ask a question like this. We want to ask an open question. So we can say, so how are you feeling? And they say, oh, I have chest pain. Where is it? Oh, it's right in the center of the chest. Okay. Does it move from there or does it just stay right there? And they say, oh, yeah, it goes down my left arm. Okay. So on a scale of 1 to 10, 10 being the worst pain that you ever felt or can imagine, what would this pain be right now? And they say, oh, it's a 10 out of 10. So can you describe what it feels like? Oh, it feels like an elephant is sitting on my chest. Okay, so those are good questions to ask regarding the signs and symptoms. Okay, where is it? Does it move? How long has it been there? On a scale of 1 to 10, right? So you're asking those kind of questions. So then we can move down into the acronym. So we're going to ask, do you have any allergies? They say no. Do you take any medications? And they say, oh yeah, you know what? My doctor gave me some medication. It's called nitroglycerin. Okay. Oh, okay. So this is what they take whenever they have chest pain. So then they can go ahead and take their medication if they want to. Okay. So with this spray, this is nitroglycerin. They'll actually spray it underneath their tongue, like a spray like that, underneath the tongue, and that will get into the body right away, and it'll help to open up the blood vessels. So if they're having a blocked blood vessel, it'll open it up and it'll allow more oxygen and more blood to be able to get through. Right? So that's nitroglycerin. And then you can ask, well, do you take anything else? They say, oh yeah, you know what? When I have this problem, I take aspirin. Okay, so then they can go ahead and take the aspirin. So that's what they do for this condition. Okay, so you can ask them, you know, whatever medications they take, and if it will help them, then they can go ahead. If it's not going to help them, then we recommend not to take it. But that's up to them. So you're not going to give anybody medication. That's between them and their doctor. Okay, so signs and symptoms, allergies, medications. So do you have any previous medical history? Have you been diagnosed with any conditions, any problems your doctor has said you have? They say, oh yeah, my doctor said that I have condition called angina, where my blood vessels are blocked off. And I've had a heart attack in the past. Okay, so that's good history from them. When did you eat or drink last? And they say, oh, I had a cheeseburger about an hour ago. Okay, and then what was happening right before the chest pain happened? They say, oh, I was running up the stairs and I felt this chest pain. Right, so now we have a good understanding, a good history of their problem. So if they were to go unconscious, and pass out, then we can pass that on to the paramedics. So we can tell the paramedics, hey, when I was talking to them, he said he had chest pain right in the center of the chest. It went down the left arm. It was a 10 out of 10, and he's had a heart attack in the past. He takes nitroglycerin, and he took aspirin as well. The doctor has prescribed these for him, and he took them in front of me. And he had a cheeseburger about 2 hours ago, so we just give them the history. Okay, so that's what we're going to do for history. All right, so history, vitals, head to toe. So now we're on vital signs. So for vital signs, you can see that we're going to look at the level of consciousness first. So we use an acronym AVPU, A-V-P-U. So alert, right now everybody's alert. Hopefully you are. Right now everyone is alert. You can answer questions, your eyes are open, okay? But if you're not alert, then maybe someone has drank a lot of alcohol and now they're reduced. So maybe your roommate in college, you know, they're laying on the floor, it was their birthday and they were drinking a lot, and you say, how was your night? And they say, right? They're not responding with coherent sounds. Then for that person, they're only responding to verbal. Then even more reduced, the person drank a whole bunch and now they're laying on the ground, and you say, hey, how's your night? They don't respond. But then you pinch them and they flinch. All right, so for that person is responding to pain, right? And then they just go back to their unconsciousness, right? So that is they're only responding to pain. And if they don't respond to your voice, they don't respond to pain, right? You can pinch them on their trap muscle here. That person is unconscious, okay? So we're going to say that they're unconscious. That's their level of consciousness. Then for eyes, we're going to look at the eyes. So if you have a light on your phone, you can flick on your phone flashlight and you can actually look at the pupils, the black part in the eye, right? So we want to see with their pupil, is it the same size from side to side? Because if someone has a head injury, one pupil could get bigger and one pupil can be smaller. Okay, so if you get hit on the right side in the head, then maybe that right eye is the pupil's gonna get bigger, and the other one will probably stay the same size. And so that's abnormal. Your pupil should be the same size. So when you look in the mirror next time, when we take a break, I want you to go look in the mirror and I want you to see, is the black part of your eyes the same size from side to side? It should be. And so you can take your flashlight, we're gonna shine it into their eye like this, in and out. And then we're gonna bring it around and in and out. Okay, that's how you're going to use the pen light or your flashlight on your phone. And so we wanna make sure that when we shine the light in, their pupil gets, what do you think? Do you think their pupil will get bigger or the pupil will get smaller? Yeah, so the pupil is going to get smaller because when you look up at the light, right, you look up at the sun, your eye wants to protect your body. So your eye wants to actually protect the retina at the back. So it'll get smaller because there's a lot of light coming in. But if you're in a really dark environment, your pupils will get really big. If you're walking to the bathroom at nighttime, your pupils get really big because it wants to let as much light in as possible so you can see. Right? So when we shine the flashlight in, the pupil will get smaller and then it will come back as we take the flashlight out. So that's normal. But if someone has a head injury or a spinal cord injury, right, then when we shine the light in, their pupil may not change, and so that would be abnormal. So we're looking for normal or abnormal. Okay, so that's we have our levels of consciousness. We're looking at the pupils, and now we're going to look at the skin. So we're looking at the skin color, condition, and temperature. So the skin color, condition, temperature, normal is warm, pink, and dry. Pink. I know you're thinking that. Pink is the normal skin color? Yeah, right? Pink is actually the normal skin color. But you know, back when I used to work in a transfer ambulance, I never knew that at first. And so whenever I'd transfer a patient, I'd write, under skin color, I'd write white, black. So that's actually not correct, right? So everybody is pink, no matter how light your skin is, no matter how dark your skin is. Pink is the normal skin color. And we're actually talking about blood flow to the skin. So if you were right now just squeeze your palm like that, right? You squeeze it and it turns light and then blood comes back in. Okay, you can do it on your nail beds, right? You pinch it and watch the blood refill. And so what we're doing is we're squeezing the blood out of the capillaries, the small blood vessels. So this is actually called capillary refill. We squeeze the blood out of the capillaries and we watch it refill. So it's called capillary refill. Okay, so we have our levels of consciousness. Okay, right now everyone is alert. We have our pupils. We say that the pupils are equal and they respond to light. So pupils are equal and responsive to light. And now we have our skin color, condition, and temperature. All right, so now we have the last ones, our pulse and our breathing. So for pulse, you can see that we have the normal pulse for adult being 60 to 100, and it goes up in 20s. So 60 to 100 is normal for an adult. And yesterday we said the adult was 8 years old and above, right? So someone who's 8 years old and above, then they'll have a heart rate that is between 60 and 100 when they're at rest. Okay? So then the child is going to go from 80 to 120, the infant from 100 to 140. Okay? So all I want you to know is the normal adult levels, so you can see that the adult is between 60 and 100. So then we're looking at the rhythm and the volume. So then for breathing, we're going to see how many times they breathe in and out is 1, and in and out is 2. Okay? So for breathing, then we're going to look at their rate, their rhythm, and their volume. So normal for adult would be, so what does it say? Normal for adult is between 10 to 20 breaths per minute. Yeah, so 10 to 20 breaths per minute is normal for the adult. Okay, and so then you can measure, you can memorize the child and the infant if you want to, but all I want you to know is the adult. So we know that the adult's heart rate beats 60 to 100 times in a minute, and then for breathing, we breathe in and out is 1. We do that 10 to 20 times in a minute. Okay, so now you can measure to see how many times does their pulse beat. Right, so when I feel my pulse, so take a look right now. I want you to find your pulse. We're going to take 2 fingers. Never check with a thumb. You're going to check with 2 fingers right on the pulse like this. So you can feel the bump on the bone right there. Right? The bump on the bone right there. You bring your finger right over to the side. Right? And then that is where the pulse is. We're going to put our pulse right there. We're going to check our fingers right there on the pulse. Check your pulse. So everyone do that now. And you'll feel the pulse going beat, 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 beat. Another place to check it is your carotid artery. So you're going to have it on both sides here. One right there. One right there as a blood vessel runs like this. So here's your trachea, your windpipe. And you have a muscle on the side. So right in between that, you're going to find your carotid artery. Okay, so you can check the pulse there. All right, so then the next one, we have our breathing. We're going to see how many times they in and out, in and out, in and out. Okay. So then we're going to, that's the history, the vital signs. Now we're going to go into the head-to-toe assessment. So what we want to do is we want to look and feel. We want to look and feel from head to toe. Doing our ongoing couch to care. Here's our head to toe. Yeah, so we want to do our history, vitals, head to toe. So our head to toe assessment, we're going to feel now. So let's all do this on ourselves. Everyone put your gloves on. Okay, so what we're going to do, we're going to go from head to toe. Let's feel around the head. Right, so is there any depressions in the skull? Is there any bleeding? Look back at your gloves, right? Is there any blood coming out of the ear or gray fluid? The brain fluid, the cerebrospinal fluid. Is there any fluid coming out? No, that's normal. That's just earwax. No. If there's a gray fluid leaking out of the ear, then that could be coming from the brain, and that's not good. All right, so we would note that. So we're not trying to diagnose anybody, but what we are trying to do is we're trying to gather more information of what we need to tell the paramedics when they get there. Okay, so let's take a look at the eyes. They're still there. The nose is there, right? The tongue and teeth are still there. We can feel down the back of the neck. Is there any pain? And they say, oh, okay, so there's some neck pain, so we're not going to touch that anymore. We're going to feel down the trachea, make sure it's the midline of the body, feel across the collarbone. Okay, going to feel upper arm, lower arm, upper arm, lower arm, right? So no bones broken. We can see, can they grip onto our hands? So we'll take 2 fingers, we'll put our fingers into their palm like this, and they're going to squeeze like that. All right, we can test their strength. If someone's having a stroke, one side's going to be strong, the other side's going to be weak, and that's the side that they're having the problem with the stroke. Okay, let's keep going. So we can press in on the rib cage. In the abdomen, we have 4 quadrants. So we have 4 quadrants in our abdomen, right? So we have the line down the center, and we have the belly button here. So we have an upper right quadrant, we have an upper left, a lower left, and a lower right quadrant. Okay, so those are the quadrants in the body, and you have organs in different quadrants. So when we press in, so press in right now, right? Deep enough to feel organs. Are you doing it? Yeah, so feeling those quadrants. And so when you press in, you can let go. When you let go, does it rebound or does it stay sunken in? Try it now. Press in and let go. It comes back to normal shape, right? And that's normal. So you shouldn't have any extra pain when it rebounds like that. Maybe if you do, and it's the lower right quadrant, you might have appendicitis. Okay, so that's just a test for that. So those are the different quadrants. We're going to feel on the hip bones, upper leg, feel the upper leg, feel the lower leg, have them wiggle their toes, right? And we can roll them over, feel down their spine and both shoulder blades, and then we're done. Okay, so that's how we're going to do our head to toe assessment. All right, so those are all of our lead up steps. That was a lot of information. Okay, so just to recap, scene survey, make sure it's safe to enter. If it's safe, you go in. You can introduce yourself. Hi, my name is Brock. I'm a paramedic. Or hi, my name is Brock. I'm a first responder. I'm trained in CPR and first aid. Can I help you? And they say yes or no. They give you consent. So we have our scene survey. Then we do our primary survey. Primary survey is what? A, B, C, and D. Airway, breathing, circulation, deadly bleeding. That's right. And now we move into our secondary survey. And our secondary survey is a song I taught you earlier, and that is History Vitals, head to toe, head to toe, head to toe. History Vitals, head to toe. That's secondary survey. That's right. So history, sample history, right? Vital signs, we measure the 5 vital signs, and then we do a head to toe assessment, looking for any other injuries. And if you find it, then you treat it. If you don't find it, then don't worry about it. Everything's fine. All right, so that's our scene survey, primary survey, secondary survey, and now our ongoing casualty care. So our ongoing casualty care is just waiting and making sure the patient's comfortable, doing everything until the paramedics get there. All right, so what can be included in this? Well, we could put them in some type of position appropriate for their condition. Yesterday we said that someone who is unconscious gets put in what position? That's right, on their side, just like we see this guy here. That's called the recovery position. We said someone who's conscious gets placed in what position? They get placed on their back, called the supine position. We said someone who's pregnant and conscious, what do we do for them? Yesterday we did, right? If they laid on their back, we put the pillow underneath the right hip to move the baby off to the left because blood returns back on the right side. That's right. And then if someone has a spinal cord injury, a neck injury, we're going to hold their head so it doesn't move, just like that. Okay? So those are our different positions. And so we can put some type of position appropriate for their condition. We could also call their parents, call their spouse, and tell them that they got an accident, they're going to the hospital. Okay, we could cover them over with a blanket to maintain their normal body temperature. Okay, so we're not going to leave the casualty, we're just going to keep monitoring them. And so that's what we're going to do for the ongoing casualty care. All right, so do we have any questions about that so far? If you do, what I want you to do is you can send me an email or you can send me a text message and I can answer them right through the text message. So let's do it that way. If you want to text me, my number is 519-919-9235. So if you have any questions, send them in the text right now, just so we can keep this live. Send them in the text right now, 519-919-9235, and I'll text you right back, and I'll answer the question for you. That way you have it while you're thinking about it. Okay? All right. So that covers all of those steps. Those are all the steps that we need to do to be able to have an efficient response and to kind of line everything up so we don't miss anything. Okay, so this is just our last topic I wanted to cover in this video, and we'll take a short transition break, about 3 minutes, and then we'll get back into the next information. All right, so this is fainting and responsiveness. So we've been going for about 26 minutes now, so let's just cover this last section, and then we'll take a little break. All right, so here is fainting and responsiveness. So have you ever seen someone just be standing normal, and all of a sudden, they pass out? Yeah, so that's what fainting is. So someone's standing there normal, and then all of a sudden, now they're unconscious on the ground. And so fainting is a brief loss of consciousness, right? It's just brief. So by the time you get there and you say, hey, what happened? They say, oh, I just fainted. Okay, so it's a temporary shortage of oxygen to the brain. And so fainting can be from, that's the main thing, the temporary shortage of oxygen to the brain is why someone would faint. So here we go. So it could be from some of these conditions, right? Just move over a little bit. Blood loss, it says there. Medical conditions, shock, head injuries, poisons, choking, hyperventilation, right? These are all reasons why someone could pass out. If it's just too hot, maybe they didn't eat, low blood sugar, right? There's many reasons why someone can pass out. But you know what your body does? Your brain is measuring the amount of oxygen in your blood. Okay? So we'll just keep it simple like that. Your brain is measuring the oxygen in your blood because it needs oxygen. And if the brain doesn't get oxygen, it says, hey, I'm not getting oxygen. Warning, I'm not getting oxygen. Power down. Like your computer, if you press a restart button, it powers down. But then what happens? It powers right back up. And so as soon as you hit the ground, now you're laying on the ground like this. Now your heart can pump up to the brain. It can pump back down to the toes. Now everything has oxygen again, and you wake back up. Yeah. So that's how fainting goes. All right. So for fainting, if someone faints, you survey the scene. You come in, and then you want to identify yourself and look to see if they have any A, B, C, D problems, the primary survey. So there's no airway problem, no breathing problem, no circulation problem, no deadly bleeding. That's good. Then we can say, hey, what happened? I just fainted. So we need to find out why they fainted, and we can do our secondary survey, history, vitals, head to toe. So from the history, we can get information to find out why they fainted. We can measure the vital signs, do a head to toe assessment, and then we can roll them into the recovery position. Okay, so what you're going to notice as we talk about all these different conditions is that these steps, we do them on everybody. Scene survey, primary, secondary, ongoing casualty care. Scene survey, primary, secondary, ongoing. These steps, we do them all the time. So now that you know those steps, you know that you have to do that. You know you have to survey the scene. You know you have to check for responses. Hey, are you okay? Right? We know we have to call 911. We know we have to do the airway, breathing, circulation, deadly bleeding. We know we have to do history, vitals, head to toe, and then our ongoing. Right? Now that we know we have to do all of that, now you can think, okay, now what else do I have to do? I have to perform some specific treatment. So now the class is basically just talking about what is the specific treatment for fainting? What is a specific treatment for a nosebleed? What is a specific treatment for someone's arm that's chopped off? Right? What is a specific treatment? So that's why I wanted to just summarize this and end with this condition, because Now we have the whole response. We put the whole response together. Now you know all the steps. We walk through every single step now. And now we just think, what is the specific treatment? So specific treatment for fainting is to ensure good ventilation, place the casualty in the recovery position. And then we need to find out why they fainted, right? And that will probably follow up with some medical attention. Or if they're too hot, put them in a cool environment, those kind of things. All right, but that's what we're going to do for fainting. So that's been our first section. Thanks for being attentive. And so we have all of our steps put together now. So let's take a 3-minute transition break, and we'll move on to the next sections. But in those next sections, I want you to think about what is a specific treatment. Now that I know all the steps, what is a specific treatment of what I need to do? All right, so let's take that short transition break, and we'll be back for more action.